So one of the things we hear about cone beam imaging, the fact that it's computed tomography and we can get all kinds of images with a computer, and similar to what was being done in medicine, the computed tomography being done in medicine, but it did it at a much smaller dose. And that's true. And that's true. And of course, we evaluate hard tissue structures, so it's helpful. Now, the systems that were used, that are currently used in medicine, are the detectors and the scanners, and the software is much more powerful in terms of its contrast resolution ability. So we really evaluate structures primarily in the calcified densities, and it gives us very good contrast resolution of bone, but as far as the contrast resolution of soft tissue, it's very poor. It's not designed to do that. And if you want to do that, then you have to get one of the other type of CT scanners that's used in medicine. But we have to stay away from the term dental CT and medical CT, because cone beam is now being used in medicine as well. And they make cone beam units for otolaryngologists, ENT doctors, orthopedic surgeons, because they want to have that ability to evaluate patients in their office without sending them off to a facility, and they're looking primarily at hard tissue. So they're using cone beam too, so you can't say it's a dental CT for them. And the other thing about what we used to call medical CT, it's got, instead of like the one flat panel detector or one image intensifier, it's a multi-detector type of system where it takes the data so quickly, sends it to the CPU system, and immediately is re-energized to get data on another area, and it's a much more expensive type of system. And they're called multi-detector CT units. And so if you're using the term medical CT, dental CT, I just encourage you to stop it, because it's just not, it's old terminology, it's not appropriate anymore. So just use CBCT, cone beam, then everybody knows what you mean, because that's primarily what dentists use. And I'm sure some of you will remember, before cone beams were around, we actually did use data from MDCT units, or the old, quote, medical units, because there was software that could evaluate the jaws and give you the type of reconstructions that we find very helpful in implant imaging, but it's just very expensive, so it didn't keep up until, and then when cone beams came in, then a lot of the software that was being used with the MDCT systems were being incorporated in the cone beam systems. All right, so one of the benefits, of course, is less radiation, and if we're just talking about hard tissue and the contrast, the gray contrast in hard tissues, it is very good and much less radiation.